thank you everybody for I'm hoping a great session so far, all my fellow speakers. And what I want to do over the next 20 minutes is talk to you about virtual care and remote patient monitoring based on some clear acceleration in these areas, specifically over the last year, but something that had been building momentum for a while, even before that. So let's get right into it. One of the things that, first of all, I'd like to just ensure we're on the same page is that when we talk about virtual care, it's a set of core capabilities and functions that have to be delivered as part of the entire virtual care program. I believe everybody on the call today has listened to and heard, and I'm sure has participated in conversations around virtual care. But when we step back for a second and look at the ecosystem of capabilities required to really drive a virtual care program successfully off the ground and then scale it, there's a bunch of capabilities needed there, right? Remote monitoring is one of them, but in addition to that, some aspects of virtual care program, like virtual visits, like clinical integration, like billing and reimbursements, like e-orders, and like thinking about frictional experiences and mobile experiences there, have each one of them been maturing at their own pace. When you put them all together and really bring a strategy around, how will virtual care solutions drive the goals of, from a healthcare perspective that you and your organization, your population may have, that's where remote patient monitoring and remote monitoring really play a role as well. So for us, when we think about remote monitoring for us is just one component of an overall virtual care set of virtual care capabilities that you may consider. Some of you may, a lot of you may already have a mix and match of a lot of these capabilities, but it's really about thinking holistically and saying, how does virtual care bring all of these together? Now, let me double click in from a virtual care perspective, specifically on remote monitoring and remote patient monitoring. One of the things that we've been working on are really looking at how does remote monitoring actually impact the entire care, the care continuum. So, for example, when you think about remote monitoring, first of all, we have to acknowledge the fact that from a remote monitoring perspective, there's applications and use cases at the provider, in hospital, and at home. And what those use cases are widely, are different for different purposes and the different goals as an organization that you may have. You may have, goals around, let's say, virtual care. You may have, virtual visits. You may be looking at condition monitoring at home for specific conditions, for specific populations. Be looking at behavioral wellness solutions. You may be thinking about in-room monitoring in the hospital. You may be thinking about, remote ICU monitoring capabilities, post-surgical recovery monitoring, chronic disease monitoring. So the use cases are plenty, and they span across, at home use of devices that could give you that data, but also in the hospital or at the provider. Now, surrounding the devices and the data that are being used in those settings, there's experiences, application experiences that either the patient is using, or it's available to the providers, or available to the care staff. And those experiences are really ensuring that the data has been presented in a way that's driving the right actions. Whether from a behavioral wellness perspective, the actions might be making sure that you have healthy habits and goals. From a ICU monitoring perspective, the insights and actions are going to be completely different. And for that, you also need to ensure that there's the right type of clinical workflow integration that has been done to ensure the right people are able to take action on the right type of information that's presented. So given that, let's talk about what are the various components of how we see remote monitoring. On the first example is this concept of remote location monitoring. So things like where patients are, where the assets are, contact tracing, staff tracing, asset management, maintenance management. Those are very impactful use cases, but again, those use cases are largely more on the hospital and at provider side. You also, from a remote monitoring perspective, when you double click deeply into asset monitoring, you may have things like making sure the inventory of, as we're going through right now, vaccines and expiration and the quality of that, temper monitoring. Those are examples of real asset, deep asset monitoring use cases that can get turned on through remote monitoring. You also get the idea of environmental monitoring, and then environmental monitoring is used very much to add context around patient health. What the temperature was the sound level where they are, the air pressure, humidity, and all those variables that could play a role in the actual condition at the moment in time, and having that understanding can add context to and enrich the data that is being collected from the devices. And the last component, and by the way, the environment monitoring can be done at home and in the hospital, right? So if I'm at home, if I have, for example, a condition like dementia, knowing that the door was shut or closed, and whether it's locked or not, whether I've fallen or not, those are important considerations, right? So you have access and insights into that can provide further validation of the data you're collecting from the devices. The final component, the piece of puzzle for remote monitoring, is remote patient monitoring. Now, remote patient monitoring, and it really is something that has been talked about the most, is around collecting very specific health information from lots of custom devices, specialized devices, wearables that people wear at home, and there's a whole bunch of data that is being collected from all of them. But remember, the goal here is to understand what are the use cases, when am I using this, and how does this fit in my overall remote monitoring thinking, and remote monitoring, how does that fit into my overall virtual care strategy, right? So we double click on remote patient monitoring. I mean, you can go into each one of these areas quite deeply, but let's focus on remote patient monitoring for a second. What are the considerations when you think about virtual care programs and thinking about remote patient monitoring? Some considerations that we've seen specifically over the last year that drive decisions around what needs to happen. So one of the core considerations is what are the high impact use cases? What am I really trying to get to? What are the outcomes am I looking for? And how is the remote patient monitoring going to help me get those outcomes? The second is the really important one, which is, how is the data coming from, these devices, these great devices? How is that going to help me in clinical decision making? How are my workflows going to be impacted? Do I have broad alignment and input from the various the caregivers, the care staff, the physicians, and have they all agreed upon the mechanism of how this data will be used? And it's one thing to integrate data from devices into EHR system. It's another thing to ensure that the people who are using that system are able to understand and have agreed upon how exactly the clinical workflow will actually use this information, and then how is the decision making going to actually be conducted based on these insights. The third is billing and reimbursements. It costs, this costs infrastructure, and so how do I, and there's a lot of movement in this space, specifically in the Medicaid, Medicare space. So virtual care is being, there is some reimbursements for that. So certainly be aware of that. The fourth area is very, this may seem very mundane, but it's actually something that has come up over the last year, is the impact on the infrastructure, specifically in the hospital. So when you think about in-hospital in-room monitoring, or even things like remote ICU monitoring, think about the impact just on simple things as power. If you've got specialized devices, 5 of them, 8 of them, that are providing very specific insights and data, then how are you dealing with the power requirements of those? For example, how are you thinking about connectivity and the impact on the overall Wi-Fi? So as a health system that's investing in the core infrastructure, like connectivity, it's an important consideration. Now you have devices that could be BLE oriented, you have devices that use Wi-Fi, you have devices that could be using cellular, but point is that there is thinking that has to go through there to make sure that it's thought through. And the final consideration is technology standards. We've heard a lot about the various cloud platforms, process automation, FHIR as an interoperability standard. How do I use all of this to ensure that what I'm building is actually sustainable, is scalable, can actually help me spawn various use cases without rewriting and without rethinking the entire thing, right? Because at the end of the day, the devices are the same. How can I ensure that the data that I'm receiving can be used for various purposes and allow me to actually think about my virtual care program holistically? Okay, so given that considerations, there are some core building blocks that have to be considered for when you think about remote monitoring generally, and specifically, yes, even for remote patient monitoring. So the first is obviously a set of, assuming that we know the use cases now, we understand the impact, we have clear understanding of the clinical decision making and the workflows. Now I'm taking a peeling the onion one more layer and saying, okay, assuming that's there, how are we going to then take some building blocks that exist and put them together to build a solution? Now, one of them obviously are the devices. So there's tons of new devices, a lot of innovation happening in this space. And we're talking to one client, maybe middle of last year, 3 or 4 months into COVID, and they basically said that we've got tons of companies that are innovating in this space, coming to the table, bringing their devices and helping us, understand how best we, what the value of these devices would be, specifically in the in-room monitoring when patients are, from a COVID perspective, in the rooms for a very long time, and given the fact that you can't go in as much as you'd like to see them. So there are devices that are continually coming to market and that are innovating, the kinds of data they're providing, and and more importantly, how they can enable the various clinical workflows. One component that you should be aware of is this idea of device data aggregation and transformation service. So one of the things that have happened in the industry is that there's a clear recognition that the plethora of devices, right, are many, and they'll continue to grow, and the breadth and depth of them are just too many. So rather than me trying to figure out how best I'm going to plug things in, there are solutions out there that are focusing on being the data aggregator for health, medical devices, wearables, etc. From there, you can think of really tying that into more of an IoT platform. The IoT platform has very specific benefits around understanding the device and tying it back to some of that contextual data and patient, etc. But more importantly, it gives you access to then the overall, what I'm calling the data and the analytics subsystem. Here's where you can do things that John was talking about earlier around data processing and storage, the real-time and near real-time rules engines, analytics, AI, data visualization, and also process automation. Because at the end of the day, we want to understand and have a clear view of how am I going to take these insights that are being generated in real time, the rules that are being run, that could be personalized based on certain understanding of conditions and situations, and how am I going to automate the processes that are required to ensure that the right person, the right team, the caregiver team has their insights and the right actions they need to take to deliver the care. And then on the side you have a layer of API and integration, layer to ensure fundamentally that the applications that you may be envisioning or already have, or the portals that you already have, or the new applications that you may be coming or thinking about bringing to market, and then the EHR that you have and the other workflows that you may have and the data sharing that considerations you may have are all getting done. Underneath that, there is a need for a FHIR standard. The application of the FHIR standards is really key for this. And for me, it's a real great example of the value of the FHIR standards. John talked about that in the previous session around FHIR API from an Azure perspective, and it's really that standardization that that allows us to get the data and convert it into a FHIR resource and ensure that the interoperability from a systems and standards and database perspective is available. And then fundamentally underneath all of that is the connectivity and all of that. Now, one thing I'll say about connectivity here is that an increasing area of innovation in connectivity is in what is called the private LTE space. So large hospital systems, for example, can deploy a private LTE network that's disconnected from the Wi-Fi. So the devices are using today a 4G, but certainly they'll be 5G enabled, so that you're actually being able to deploy a large number of devices in a very private cellular network capability deployed on premise that allows you to provide deliver on that sort of connectivity goal. So there's innovation happening there as well. One note on when you think about data and wearables data, medical device data, the standardizing data is a critical aspect of this. We've done a lot of work in this area. So things like even simple things like unit of measure conversion from one device to another, so imperial versus metric, data aggregation. You got various different file and data formats that we're all used to and are quite aware of, API protocols, transmission protocols. So you've got a lot of different ways on how data is coming at any point. You've got to be able to standardize that. You've got to make sense of it. You've got to essentially transform it and be able to actually use it effectively in real time. And some of these data aggregation services actually do a pretty good job of that. So it's not something you have to take on per se, but it's just the fact that you understand that these things have to occur. So we've looked at the building blocks to consider. from a perspective of some of the tools that provide sort of that device aggregation, you've got solutions like Validic and Human API. There's more. I just listed two of them. On top of that, you've got the IoT platform and the data subsystem with Azure. Very strong in, and as John was saying earlier, around IoMT enablement, the breadth of capabilities and services that support that, and then UiPath really taking on and helping in more of the process automation side and the connectivity there that it has. In fact, you could take, for example, machine learning models from Azure and ensure that they can be used in UiPath as part of the maybe an intelligent process automation as well. And underneath that, from a FHIR perspective, you heard again from John that we've got, not only do they have an Azure IoT connector for FHIR, what that does essentially is takes data, wearables data and medical data coming from devices, and converts that into an FHIR resource that can then get integrated, largely within the backend systems, along with the Azure API for FHIR. So the solutions are there. I think the main consideration is of the use cases of how we think broadly about FHIR. How we think broadly about virtual care, the impact of that. What is our roadmap for delivering virtual care broadly, and where does remote monitoring fit into that? Can I use the infrastructure that I'm creating for remote monitoring to support, real-time location service, asset monitoring, environmental as well as remote patient monitoring? And I think it's thinking broadly about that and ensuring that the plan and strategy that you put in place and the technologies that you are and partnerships that you're going to be able to take into consideration help you, deliver on those, right? So I'll give you an example of Vitality. Vitality is a customer that we've worked with very much. This is focused on behavior wellness, and the idea is, in this particular case, by the way, right? I mean, the idea of wearables and medical devices isn't just related to providers. The payer community is very interested as well, because it drives proactive, healthy habits and outcomes, managed directly by the health consumer. So they're able to actually participate in that as well. So in this particular case, Vitality is one of the leading behavior wellness platforms in the world, and many different payers, actually white label this platform as a offering to employers and employees, specifically who are interested in managing proactively their own health, creating healthy habits, and being rewarded for them. And it's a great platform. But one of the things that obviously comes with a platform like that is exactly the kind of enablement and the building blocks that I discussed earlier. So tons of integrations across wearable devices through a data aggregating service, backend IoT platform. When you think about personalization as a way for driving suggestions or a next best action to a particular person of what their healthy habit or their next best action should be to maintain or to expand their healthy habits, you need platforms that can support those kinds of things. And then, certainly in this particular case, we have to also integrate reward platform systems to ensure that there's, enough value in people being able to continue to actually, participate and use platforms like this and deliver better outcomes. So, a quick note on Productive Edge. We are very focused on healthcare. We think about virtual care, remote monitoring, the use of data and insights, clinical workflows, very much so. And the way we think about sort of virtual care and remote monitoring is really in 4 key areas, right? So it's about the business case and the iterative value, right? How do we understand and help our clients, kind of tease out what those clinical workflows are, what that mechanism, the decision making will be, what are those high impact use cases, and how do we think about helping, bring those to start getting them off the ground, but then make sure that we're able to scale that to a wide. And I mentioned 4 or 5 different use cases. How do we tie this to well-informed outcomes that have an agreement and alignment across the various stakeholders in the organization? And then there's a TCO behind that. We've got deep domain expertise, a lot on the data standardization, data aggregation, wearables, IoT platform, behavior wellness, a lot of partnerships that we bring, cloud platforms and data platforms and aggregator services and connectivity providers and device and medical device manufacturers. So from our side, we really think about how can we come in as the one party that can bring the breadth of that capability and help you ensure that you've got a vision for virtual care and remote monitoring, and that the blocks that you're building can help you sustain and deliver value, and increasingly over time. So with that, I want to thank you for taking the time. We're happy to answer any questions in the panel later.